Get ready with me while I show you guys my morning skincare and makeup routine. I'm a 47-year-old mom of a 3-year-old and a 21-year-old with a diagnosis of early onset Alzheimer's disease. In this first clip, I have the smoothing filter on and I'm just showing you the prep. I have no idea how you guys get ready and talk at the same time. So I'm going to talk about how I was diagnosed, what my first symptoms were, and how it is to be a mom with a toddler having this disease. I'm also going to go over what I'm doing to treat it. Okay, here we go. Jump scare, filter off, no makeup on, skin prep done. I got pregnant organically with my 3-year-old when I was 43 years old. I ended up having him 4 to 5 weeks early via emergency C-section. It was the scariest moment of my life, immediately followed by the happiest. I was 44 when my son was born, and I had been having symptoms, but I thought they were pregnancy brain fog and postpartum issues, mainly just forgetfulness. When my son was 2, my symptoms really began. I started noticing a lot of word-finding difficulty and switching words, like open the carpet instead of open the curtain. I was also having a lot of short-term memory issues. Someone would ask me a question and I could tell that I should know the answer, but I had no idea what they were talking about. It was like things had just disappeared from my brain altogether. I went to my primary care in August or September of 2024 and asked for a neurology consult. I had my first neurology appointment set for early December. I was currently working as a hospice nurse in their telehealth department. During my first neurology appointment, all my cognitive testing indicated that I had mild cognitive impairment. Then the testing began. I got an MRI of my brain and spine, an EEG, a lot of blood work. Everything came back normal. I then told my neurologist that I was worried about Alzheimer's because I had a grandmother that had it. She said, I don't know if your insurance will cover it, but we could do blood biomarker testing just to rule it out. My p-tau 217 and p-tau 181 came back elevated, and from there we ordered the amyloid PET scan. The results came back widespread amyloid plaques in the brain, reading a positive result. Obviously, I was devastated. I now knew that I had early onset Alzheimer's and was a mom to a 2-year-old. After months of fighting the insurance companies, I got on the Leqembi Patient Assistance Program for the anti-amyloid therapy, Leqembi. It's meant to slow the progression of the disease by removing the amyloid plaques from your brain. I get an IV infusion every 2 weeks for 18 months total. I've now completed 13 doses. I have to be monitored closely for ARIA, a side effect of the medication that could cause brain swelling and bleeding. So far, so good. I'm doing great with the treatment and very hopeful that it will slow my decline. More than anything, I just want to spread awareness and show that early detection and early intervention can help with a better outcome. I'm also hoping to help remove the stigma for this disease, showing that there are different stages of this disease, and some people get it when they're younger, and you aren't able to even tell they have it. They are still able to do things for themselves. Filter on. Filter off.